This is a virtual consultation for lip reduction. So lip reduction is basically divided into two major categories. Lip reduction for those patients that have an artificial result, either due to silicone, other permanent injectables, fat grafting, Gore-Tex, Aquamid, Aquaplast injections to the lips that makes the lips look unnatural. And the second category is sort of congenital or ethnic lips, typically more African American, Southeast Asian, Hispanic, but also just anyone that's born with a larger lip or a lip that they don't like. Another subcategory is someone that has a traumatic lip, someone that doesn't like the lip because they've had an accident, or they just had a cleft palate with a lip that left a little blip that didn't look right. So these are just the general indications for having a lip reduction. So I perform more lip reductions than probably anyone in the world. This virtual consultation is going to help you understand sort of the pros, cons, limitations, recovery, etc. with it. So the procedure itself is done under local anesthesia. A lot of people are very scared when they hear that because they think there's going to be a lot of pain. But I'm actually really, really good at not making this painful. And I know that sounds insane, but I've really mastered the technique of doing a dental block that just has no pain. And every single person coming to me is incredibly anxious. They're worried it's going to hurt. They're worried what they're going to go through. But almost universally, after about 10 or 20 minutes, you feel more comfortable. So who is a good candidate for this? Well, I've told you about the indications. But one thing I always tell my patients is please trust my aesthetic eye. I have a really good judgment about how much I need to remove off the lip. And I'm not trying to dictate that to you. I really want to hear it. So for example, if it's an ethnic lip, you may just say, look, I really want a very small amount. If it's an artificial lip, though, I really want you to trust me to try to get it as natural as possible, rather than you're saying, oh, take a little bit off. I do not like unnatural results. And so if you're going to pick me, I really need to help you get a natural result. So, some patients come to me and they say, look, I just want a little bit taken off. And I can take little or more, but there is a trust level where you're going to say, Dr. Lamb, you've done so many, maybe thousands of these, where you're able to guide me. So that's part of the things I want to guide you to what would aesthetically look good for you. For an ethnic lip, of course, that's more complicated because you need to take enough off to make it look as if it was worth your while, but not so much that it creates a dysfunction or a problem. And I'm not here to take the maximal I can. I'm taking the amount that I need, minimal amount that I need to get the result that I want, whether it's going to be less ethnic, less hanging, less artificial, whatever it may be. I can't promise you perfection, but hopefully good improvements with this. So where do I make this incision? The incision is along the wet-dry lip interface. That is, here's a dry lip, here's a wet lip. I take down amount of dry, amount of wet is proportional. So this is a trick that I've actually developed myself. Almost everything I've learned when I was in Asia learning was going from the wet lip inside, pulling the lip in. There are several problems with that technique. The first problem is that the wet lip, if you drag dry lip inside, it's artificial. It doesn't work. The dry lip should not be sitting inside your lip. And that doesn't hide an incision. If you look at my line, I have a line there, and that line is a natural cleavage point between dry and wet lips. So it's something that I want you to know that incision typically just melts away. It's not something that I'm really worried about. With African Americans, there is a little variation in terms of how it's not a keloid, there's no scarring that I really see. But oftentimes, the African American lip there, it goes from a darker to a lighter color or a lighter to a darker color. And that transition, there is a variation where it's a little bit more abrupt and less of a gradation. And so when I do reduce it, and there's a huge gradation in color, there can be a little bit more stark transition point. It doesn't look fake, it doesn't look artificial. I always tell my patients, especially African American patients, with that variation. So the biggest risk of this procedure is a gummy smile, and that's really hard to fix, but it's important that you know that. So before you come into me, look at yourself smiling. If you see a ton of gum, and I have to reduce to like 50% of the vertical height of your upper lip, you're going to show more gum. So that's something that you need to know that. And that's just a limitation of this. And you have to weigh to what extent this is important now for you to have the lip reduction, because you're going to have more gum. Now, you can do Botox to reduce the gummy smile. There are not a lot of people that know how to do that well. I can do that very well for you, but of course you have to pay for that, and you have to come into Dallas to have that done. So to me, it doesn't make a lot of sense for you to do that, but I just want to talk about that limitation as well. So when you schedule the lip reduction with me, you're going to fly in here, I always tell my patients, please leave enough room for you to go home, because I do not want to be under pressure to try to do this. Sometimes I run an hour behind or half an hour. I don't want to hear that, hey, I just had a 1 o'clock scheduled procedure and I've got a 4:30 flight. You need to fly out after my hours are done. You can fly out the same day. The question always is, should I stay in Dallas for 3 to 5 days, 7 days for you to check on me? There's really no reason. I mean, I don't mind seeing you afterwards, but I always encourage you, please just go home that day. It's okay. A couple things, if there's a little bleeding afterwards, it's normal. If the stitch pops here or there, it's actually normal, because I have so much redundancy there, I'm not even worried about it. For the first 7 days, you're going to be on a soft diet. You don't want to be biting on anything and break my stitches, and you keep the areas quite moist. I'm recording this during the COVID crisis in 2020. Hopefully this video will be good for many years, but this is like the perfect time for people to do it, because you can wear masks to cover up that time where you're recovering. However, the biggest issue with the recovery, if this is post-COVID time, is the fact that the stitches are visible. And I always tell my patients to try to create a white lie, because people don't know why a lip reduction is performed. A lot of people think, oh, you just have stitches there. You can say you had some trauma, you had some gum surgery. That makes it a little bit easier. Those stitches do dissolve. They take about 2 weeks to dissolve. So don't panic if they're still there for a week. They'll take a little longer to dissolve. I don't want anything touched before 10 days. I don't want you to be trimming or pulling things out. If something is still there, after 10 days, you could trim them and let them sort of fall out by themselves if they haven't quite completely gone away. After the procedure, typically there's not a lot of pain. There can be pain, there can be some discomfort. For the most part, it's not that uncomfortable. I use a long-lasting block, and so when I'm done with the procedure, what I do is, especially if I do the bottom lip, I'll have you lie down and you'll look at the result lying down, because when you sit up with the dental block, the bottom lip hangs out and you can't quite see the result. And of course, after a day or two, it's swelled up a little bit, you may not see the result. So I try to show you this result right when I'm done, after I've cleaned everything, and have you lying there, and I show you the result. Again, you're going to be very nervous starting the procedure. Almost every patient is. When they realize I don't hurt them, they realize that I've done this so many times, then they usually start to relax. Almost everyone starts to relax, and it's very common. One thing that I want you to tell my staff before you come in here is whether you have cold sores, like herpetic outbreaks. If you have that, I've got to put you on the Valtrex, which is an anti-herpetic medication to minimize that outbreak chance. Other than that, we just give you some steroid pills, we do a pregnancy test and all those things, and then you can fly out later that night. In terms of when no one can tell you how to done, that's hard for me to say. It's somewhere between 2 to 4 weeks. Again, now when people are wearing masks, it's okay, but if this is being watched in 2022 or 2025, then I hope the COVID time is over by that point. But it's for the first 2 weeks or so. People usually take about 7 to 14 days off from work, just so you know that. What else I want to tell you about this? Oh, yes. So for the first 4 to 6 weeks when you smile, first of all, I don't want you to do a lot of open expressions like that for your first really 2 to 4 weeks, just so that I don't pull any stitches or anything. For the first 4 to 6 weeks, you're going to feel as if your lip is tight, and that's normal. Especially when you smile, the lip can fold and invert. The upper lip can do that. Don't panic with it. That's normal. That will soften over a period of about 1 to 2 months. The other thing is in terms of scarring. People always worry about scarring. I really have never seen a keloid. It's been years since I've seen any thickening of the scar. I think I've just maybe modified my technique. I've just not seen any really bad scarring. However, the lip can feel firm and tight. If it's firm, typically it just softens by itself over a period of a few months. However, if you are bothered by that and you want to come in no earlier than 6 weeks, I don't charge you for it. I can do a dental block, no pain, put a little scar dissolve in there, and it relaxes the lip a little faster. You have to pay for your travel expenses since the vast majority fly in for my work. However, that's just something you need to know as a limitation that you may want to do, but honestly, oftentimes the lip just softens by itself and you don't need to do that injection to soften it. I always tell my patients not to do anything within 6 months, no revision procedure, no touch-ups or anything, because everything settles over time. I do charge for further reductions, even if it's a little reduction here or there. Who's not a good candidate for a lip reduction? Well, I told you the one risk is gummy smile. The other is unrealistic expectations. So a lot of people come in, they go, if I could just make my left and right sides exactly the same. Well, symmetry is an impossible goal. You cannot make the two sides of the face the same. So even though I do with a lot of asymmetric lips way off, and I try to work really hard to make it symmetric, if your goal is just, can you make one side a little bit here and there? No, I can't. But when you smile, there's a gum that's hanging inside. I fix those. If the lip just is not proportional to the way you look, that makes sense. One risk is that there's a small segment of patients that have what's called body dysmorphic disorder, where they think their lips are the worst thing. They can't even have social interactions with other people, and oftentimes their lips are not even that big. Now, of course, it's probably bothering you socially enough that you want this done, so that's not abnormal. But if it's such a preoccupation when you can't walk outdoors and you're constantly staring at yourself, you may not be a good candidate to have this done, and that's just a limitation with this. So this is basically everything I can think about in terms of lip reductions. I hope I can see you and take care of you. I do many of these every single week. This is really my expertise. So I hope this video helped you out.